Every year, approximately 85,000 children are born with a heart condition that requires open heart surgery in Nigeria. Unfortunately, just a few hundred of those children actually receive surgery. Many of these children die from a disease that does not necessarily have to lead to death. Today, we have with us an angel on earth, Dr. Segun Ajayi, the founder of Hospitals for Humanity. He left it all, opportunities to earn a lot of money in the States, to come and help children with this condition. He needs money, clearly, to do what he needs to do. And if 1 million of us can put down 1,000 naira, we'll be able to help these children. Our topic for today is 1K, 1M. Welcome to the heart of the matter. My name is Omilola Oshikoya.
These things sometimes are psychology.
I think as one of the messages was a God experience. Wanted to find God, simply feeling like you're in fire. Make every always.
So tell us about the solution.
As one
People
of the
18 to 35 years of age, not out of work.
Hey, I don't have the skills for this particular problem to solve this particular problem.
None of us talked about the bread seller.
Welcome to the heart of the matter. Hope you've had a good week. I have, and hope you're keeping up with the 1 hour Hallelujah Challenge. For those that do not know what that is, in the month of June, every day from 12 midnight to 1 a.m. for an hour, we're praising God. And it started by Nathaniel Bassi. So please follow him on Instagram, Nathaniel Blue, or Facebook, Nathaniel Bassi Official. And join the Insta Live chat where we praise God every month. And there have been so many prophecies of mind-blowing testimonies, and there have been mind-blowing testimonies. So if you have one, share it with us. Today we have with us a special guest, someone who's making impact in the healthcare sector in Nigeria. Now, for those of you that know me, you know that healthcare is I'm very passionate about healthcare because of some personal experiences. Today we have with us Dr. Segun Ajayi.
Thank you.
Hi, Dr. Segun.
Hi, how are you?
Thank you for coming on the Heart of the Matter. Well done with all the good work that you do.
Thank you.
Okay, so what is I hope I got the pronunciation right. Congenital heart disease, is that it?
Yes, that is it.
Okay.
So congenital heart disease is a defect. You
Okay.
can call it congenital heart disease or congenital heart defect. And basically, it's a defect in the heart of any child that's born that have a structural defect in the heart at birth.
So what are the stats in Nigeria? Like, is it really bad or just a few cases? Is it very common?
So it's usually, the estimations are about 1% of all live births in any population will have a congenital heart defect. So we're looking at, in Nigeria, about 85,000 children are born each year that has a congenital heart defect. And stepping forward, we know about 100 to 120 to 150 children only get surgery every year for that surgery.
150 out of 85,000.
So out of that
Whoa.
85,000, about 70% of those defects need heart surgery. So it's still a less than 1% of children in Nigeria are getting surgery.
Is that so? If you compare that to the States or the UK, what would we be saying?
We'll be saying that it's the total opposite. Most of congenital heart defects are
Curable, so treatable.
They're treatable, and within a month to a year, the surgery is done.
And most likely the child will have a normal life.
Definitely.
So in our case, because just very few get the surgery, most of these children end up dying.
Exactly.
Wow.
And that's why we're here.
Okay, so can you tell us how Hospital for Humanity was born?
Okay, so I was about 17 or 18 years old, came to Nigeria. I drank some tap water, and I got a severe case of gastroenteritis, and I was actually hospitalized.
Is that like typhoid?
It's like the diarrhea. It's like a stomach bug, basically.
Okay.
And I was hospitalized. I was dehydrated, and I went to one of the best hospitals in Lagos. I won't say the name, but I was looking at the surroundings of the hospital, and I knew then that something had to be done. And that's where Hospitals for Humanity was born. That's where the Lord just placed that in my heart.
So obviously when you're not still 18,
Yeah,
17,
so
even though you
right.
look young.
So moving forward, so I started like a small group like in medical school, and then I began to just put the pieces together, not really knowing. All I wanted to know is that Nigeria had a better story to tell in healthcare than the one that it was currently telling. And I wanted to be a part of that change. And so it slowly began in medical school, and then right after medical school is when I fully registered Hospitals for Humanity in the U.S. We're a 501c3 organization. We also have offices in Asia and also here in Nigeria.
Okay. So I want to ask how it works, but before that, obviously we have an audience from all over the world. So we air in 44 African countries. We also air in the UK, and then we have a YouTube channel, so from all over the world. So some people do not actually understand when we say the healthcare system is, the healthcare system in Nigeria is bad. Can we talk about how bad it is?
Well,
just to put it in context.
To put it in context, I would say that as a whole, Nigeria as a whole is probably practicing medicine as if it's in the 80s or late 70s.
Whoa.
That's my personal opinion.
And this is even talking about some of the most very expensive private hospitals.
I mean,
as well.
you have your ranges of hospital, but as a whole, as an average, I think we're still like in the 80s when it comes to practicing and delivering healthcare, because most hospitals won't have most things. I mean, for example, when it comes to congenital heart disease or congenital heart surgery, there's only about 2 or 3 perfusionists in the country. So even if you wanted to do more surgeries, but you need a perfusionist for each surgery. So if you only have 3 and you know the numbers, how could you even begin to do more? So in that respect, we're lacking.
Okay, so but why? What is the problem? It seems like it's not rocket science. Like, what is the problem? I remember about 3 years ago, a family member had to have a scan, MRI scan, and in Lagos with 20 million people, we couldn't find a scan machine that was working. So thankfully I have a friend who, Flying Doctors of Nigeria, so I called her, and she said there were only 2 scans working in a city with 20 million people. Then she obviously told me, but when we got there, the MRI wasn't, one of the hospitals, the MRI wasn't even working. So she had to do a CT scan. Why? I mean, healthcare is like a basic necessity.
It is a basic necessity, but it is very expensive.
So lack of funding.
So I think healthcare is very expensive. So as you know, in the U.S., they're dealing with the healthcare bill currently. So everywhere in the world, but the government has to put priority, on the healthcare, on this community of the healthcare. I believe the main issue is really the expensive nature of healthcare. And if there was a way where it was not expensive, I'm sure it'd be better.
I mean, clearly,
managed.
our president is away. Our previous president's wife had to go away. I mean, definitely something needs to be done. So let's talk about Hospital for Humanity. How does it work?
So basically, in regards to the congenital hearts, our congenital heart program, basically for the last 2 years, we've been carrying out surgeries, training of congenital heart disease in Nigeria. So currently we have like over 1,000 children on our list. We're partnering with several hospitals in Nigeria, and we're looking at capacity building in areas of the surgeon, the anesthesiologist, the whole medical team as it relates to open heart surgery for children.
Okay, so you basically get a team from, do you also have doctors within Nigeria?
Yeah, so we have, our team is local and international, and we've been working together with that same team, and especially with the local team for the last 2 years.
So what is a revolving list?
So the revolving list is one of our it's a list that stays next to my bed every night that I pray over.
Wow.
And it's the list of all of our major cases of children that need open heart surgery.
Okay.
And so the sad part about it is that probably, 1 to 2 of those children will die a week. Sometimes you have it where more of them are dying. And so we take those children off and then we just add more children on our list of children that needs to have surgery.
And this is a list of about 1,000 children.
So we have a master list of 1,000 children, and then we concentrate on 200 of those children that need surgery urgently. And for the last 2 years, we've done several studies within our own organization. We've looked at all of the metrics and everything that needs to be done, and the only answer is that we need to be in Nigeria 24/7, training and doing the surgery, and that's what we're prepared to do.
Okay, so I would like us to talk more about that, but we need to take a quick break.
Okay.
Viewers, we'll be right back. Stay tuned. Welcome back. We're still talking to Dr. Segun Ajayi. Before we went on the break, you were talking about being on ground 24/7. Can you shed more light on that?
Yeah, so the last 2 years we were doing time limited programs in Nigeria. So we were doing between 3 and 4 programs each month, each year since 2015.
What's a program?
So a program is where our international team and our local team come together, we screen, we review cases, and we do surgeries. And we're here for about 2 to 3 weeks. And so during those 2 years, it was basically like a needs assessment, if you would like. We wanted to know exactly what were the gaps that was causing this issue with children not getting pediatric open heart surgery. And so one of the things that came out of our analysis was that we have to be on ground 24/7. The other thing that came out of it was that we have to train the local medical community that is interested in pediatric open heart surgery. So one of the things that we came up with is we also believe that no child should have to pay for open heart surgery. That is near and dear to me, and that is something that we have to maintain. My staff, my people is like, Segun, are you crazy? What do you mean? Healthcare is expensive. Not only is healthcare expensive, but open heart surgery is one of the most expensive things in healthcare out of the whole sectors. And so I'm still maintaining that no child within Hospitals for Humanity moving forward need or should pay. So now it puts the onus back on us as an organization. Okay, how am I going to pay my staff? How am I going to get all the medical equipment, the medications? And so we strategized and we came up with this campaign, and we're calling it 1K 1M.
Yes, I was going to ask about that. So what is the 1K 1M?
So
Sounds like you're running.
I know, right? But it's very simple. We're asking 1 million Nigerians to donate 1,000 naira. And that if we can get 1 million Nigerians, no matter if they're diaspora, no matter if they're in Nigeria, if we can get 1 million Nigerians to donate 1,000 naira, that will cover all of the expenses for 200 children every year. And that is what we're focused on now, is the 1K 1M. It seems very doable and very simple, but in fact, it is very difficult.
Because it sounds like 1,000 naira.
It's simple, right? Like but it is very difficult. You have to have.
What are the challenges?
The challenges is, in the present economy, not just in Nigeria, but all over the world, getting the message out on what we're doing, credibility. We have fraudulent, people have fraudulent things in your mind when you talk about money and all of that. And so that's why we have a track record of 2 years. We have 50 children. We screened over 3,000 children. And so it's difficult, and we want to get more people, more sponsors involved to help spread the word so all these children can get surgery.
So what options, have you tried like GoFundMe?
Yeah, GoFundMe works, and so one of the things that we have a fundraising ambassador, the current Big Brother winner, FA. He's part of it. We have other different types of celebrities that's joining on board, but we need more, and we need more sponsorship, and so we're using all the platforms, social media, Instagram, Facebook, you name it, we're there, and we're trying to get the word out. But it's all about getting more people involved so your word can get out there.
Interesting. Could you tell us one success story?
Yeah, I
Like
can.
something to just, because right now I'm just feeling like really sad and angry.
Well, we have 50 success stories. All we've done surgery on about 50 children, but one in particular, a child. He had what we call teratology of Fallot. It is a very structurally difficult surgery to do, and basically what happened is that he died on the table. One of our surgeons, we called me and was like, Segun, the kid is there. We're pumping the heart manually with our hand, and he said, Segun, this is the case. This child is, he's basically dead.
How old was he?
He was 9 months.
Wow,
He was
that
9
young.
months. Yeah, he was 9 months. He was 9 months, and so I was like, okay, and I was like, but he's still alive now, and he was like, yeah, but this is the situation. I was like, no problem. So I went out to talk to the mom, and I was so encouraged because I told the mom, I was like, well, this is the situation. It's not looking good for Tahir.
Was he dead at this point?
He was clinically dead, and the mom looked at me with so much conviction, and she said, "He will not die." And I was like, "Wow!" And I was like, "I'm gonna agree with you on that." And we went out, we prayed, got another call about 15 minutes later. The heart is beating on his own.
Wow.
Got another call 15 minutes after that. We completed the surgery.
Wow.
After a long period in the ICU, he had a very tumultuous time in ICU. He had a stroke. He just a hard time in the ICU afterwards. But today, Tahir is running, he's walking, he's talking, and he's living a normal life of any 2-year-old would live.
That's a miracle.
It's a miracle.
Wow.
It's a miracle. And we have so many of those stories, so many of those parents that come in. One day, a parent was like, I don't know how I came across your organization, but something, and now I'm here doing the surgery. I was like, it's okay. We're here for you.
Okay, we need to go on another break. We'll continue after the break. Stay tuned. We'll be right back after the break. Welcome back. We're still talking to Dr. Segun Ajayi. So before we went to the break, you were talking about the little boy, the miracle child. Clearly, that was a God experience, and I'm sure every day is like a miracle, every child. How has your faith in God helped this cause and helped you to stay optimistic? Because obviously at the same time, especially with the revolving list, you have to take people off the list. That must be tough.
It has really increased my faith in the Lord.
But you always like that or this sort of anchor?
I knew early on, that I had a calling, and I knew that the calling was going to be tough, and I knew that I had to stay the course. So I have emptied my bank account. I have emptied everyone's bank account around me, and trying to really get this cause out there. And so it's beyond me, and I understand that. And for my purpose is to really understand that, look, if you take one step, the Lord will do the rest. And so my faith walk is really, okay, God, do I need to go left? Do I need to go right? What exactly is it that I need to do? And obviously, a strong prayer life is needed.
So how do we actually move forward from here? What is your vision for the future of healthcare in Nigeria? Also given the fact that, yes, we say the lack of funding is a problem, but about billions, a couple of billions of naira going out of the country to countries like India,
Yeah.
Turkey every year. How can we keep the money in? And like I asked earlier on, what's the future? What's the vision for the future of healthcare?
So our future is we want to transition into building a children's hospital, an all children's hospital for free. And that way, children will be able to go to this hospital and enjoy quality medical services for free. As far as the medical tourism that you're talking about, it's a huge problem. I know that that's part of the agenda for the current Ministry of Health that they're trying to tackle. But we know that over about 1 billion USD is going out of Nigeria every year in medical tourism to India and Turkey, like you said. So for Hospitals for Humanity, our long-term goal, which is in 3 years, is to build that free children's hospital.
And how much would that cost you?
Well,
How much are you looking for? And are you phasing it out?
We are phasing it out. We actually are looking at land now in the Abuja area.
Okay.
So we're working with the FCT ministry on that,
Okay.
and hopefully something positive will come out of that. But we're looking at about 50 to 70 million USD to build that hospital. And it's going to be based on the St. Jude's model in the U.S.
That's the St. Jude's, like a children's hospital, yeah?
Yes,
I think I've heard
that
of.
offers free service.
Oh, fantastic. Wow, okay. Interesting. So, how can people reach out? If anyone wants to help, support, sponsor, or if someone has a child with a heart condition and they would like to reach out, how do they get?
So we have a website called hospitalsforhumanity.org. Parents can go on there. It's a tab called Parents. If they have a child that need open heart surgery, click on that, fill out the application. We start the process right away. For those who want to help, they can also reach out to us. Go to the website under Contact Us, and there's some numbers there. There's emails there as well that anyone that wants to help out, they can reach out to us.
Okay.
And then there's a donate button too.
Okay, fantastic.
Yeah.
So we can donate online.
You can donate online, all the various networks.
Are you on social media?
We're on social media, so our Twitter handle is @HosP4Humanity. Our Facebook is Hospitals for Humanity. Our Instagram is Hospitals for Humanity 1, and that's it.
Okay, so you're a surgeon, right?
Yes, I'm actually a ophthalmologist.
Okay.
Yeah, by training, but I run the organization full time now.
Okay, full time. So you left everything, and I know doctors are paid a lot of money in the States. You left that and you're doing this full time.
Yeah.
Wow. Takes a lot of courage.
Yeah.
But I know you will be rewarded. I'm sure you already get some fulfillment anyway.
I do.
From, but definitely God has great rewards for angels like you. Well done.
Thank you.
Thank you very much for coming on the show. It's over now, but obviously I'm sure a lot of our viewers will reach out to you to support.
Thank you so much.
Thank you. Wow. You've heard it all. This is a very important issue. There are about 85,000 children that are born with this condition every year, and only a few hundreds have the opportunity to have surgery. Let's help. Let's give 1,000 naira. The 1K1M challenge, 1,000 naira, just 1,000 naira. What is 1,000 naira to you? Most of us will spend that money on data, and we'll watch a funny video on Instagram or on Facebook, and it will go in minutes. But that 1,000 naira can save a child's life. 1,000 naira. Tell your friends, tell your family, everybody you know, to put 1,000 naira down and support Hospitals for Humanity. Until next week, stay blessed.